Super cool. All right, we're here. We're here. We're live. All right, welcome everybody watching. Shout out to my replay people. Looks like we're live officially, and we're live on Twitter as well. How cool. Okay, so let's get in the chat. So let's do what we're going to call the Valsalva squeeze. So this is something I love to do, which is basically a lot of people ask me, how can I stimulate my vagus nerve naturally? Valsalva squeeze is one of the best ways to do it. So we always start our videos off with a really quick little squeeze of the vagus nerve through breath. It's one of the best ways to stimulate your vagus nerve. It's not a long-term solution, but it does give you a short-term toning of your vagus nerve. So here's how it goes. You're going to take a big deep breath in through your mouth. You're going to hold that air in. Then you're going to take an extra sip of air at the top, like that. Then you're going to hold that air in, and you're going to squeeze it for 5 seconds. Then you're going to slowly exhale through your mouth really slowly, and then that'll be it, and then we'll start with the video, okay? So ready in 3, 2, 1. Big breath in. Sip of air at the top. Hold and squeeze. And then slowly exhale. Just like that. Now, if you do it right, you might notice you actually get a visual pattern out of your eyes. This is an indication that you successfully increased acetylcholine in your brain and your visual cortex and in your vagus nerve. So I oftentimes get an indication of visual modification, almost like I'm hallucinating if I do it well enough. So that can happen too. But it also just feels clearly relaxing. So that's kind of a way to know if you did that right or not. And practice makes perfect, so you can always get better at it if you keep on trying. So let's jump into the subject of today's video. We're going to explore the effects of aging, natural processes of aging, and how it affects the vagus nerve over time. We've been doing a lot of videos lately about aging, managing age, reversing age, testing age, and I just want to give an overview of what to expect as kind of the natural progression of what age does to the vagus nerve and why nothing necessarily bad has to happen for you to develop symptoms of vagus nerve dysfunction. Although many who are here in the group, I see because of your intake questions, and I talk to a lot of you, there usually are some like hardcore events that trigger a range of really bad health conditions. So let's jump into it. So generally speaking, the vagus nerve is also known as the 10th cranial nerve in your body. It plays a critical role in maintaining optimal body functions. The vagus nerve serves as a communication pathway generally between your brain and major organs throughout your body. It carries information being shuttled between your vagus nerve, your organs, and your brain is a really important area of concern for today's video. It's going to control your heart rate, digestion, mood, and other vital processes. And yes, mood is a function of your vagus nerve. Okay? So as we age, the function of the vagus nerve can be negatively impacted, which can result in a range of some pretty severe health issues, things that will get you to certainly notice. Main area of concern for today is going to be on the myelin sheath. So one of the main factors contributing to the decline in your vagus nerve and its function is inflammation. So everybody knows about inflammation. You've all heard of it. If you've ever taken turmeric or curcumin, you probably have some awareness about what inflammation does to the body. We know that it's bad, and we want to do as much as we can to control and regulate inflammation in the body. That's really important. So inflammation will gradually weaken this protective layer around your vagus nerve, And there's many hundreds of bits of sheath that surround different portions of your vagus nerve. So there's not just one myelin sheath that wraps around your whole vagus nerve. There's thousands of minor vagus nerve sheaths that protect different functions. And the myelin sheath allows your body to have signals sent rapidly from your brain down to your heart, down to your gut, down to your pancreas. Smooth communication is critical. Efficient communication between your brain and your body through your vagus nerve is facilitated by your myelin sheath. So, inflammation is one of the biggest risk factors for degeneration of the myelin sheath. So, what are the consequences of deterioration of the myelin sheath? Well, when the myelin sheath strength diminishes, what is affected primarily is the conduction speed between your brain and your gut. And we're talking pretty significant changes. So we've all heard of, like, everybody knows about the speed of sound. So when I say something, it takes time for that sound to travel across the room or to travel across a field. Oftentimes, if you see lightning first, a flash of light, then you hear the thunder afterwards. That's because there's a difference in the speed that the light and the sound moves through air. So certain parts of your body require almost light speed communication between your brain and your body, such as your heart, your digestion, the release of digestive enzymes, your liver, your spleen. There's different parts of your body that require that really fast communication, and that is all controlled and facilitated by the myelin sheath. So when the myelin sheath is weakened, some of those critical communication pathways start to deteriorate. And what happens is your brain starts to develop what's called like a lag time. Do you guys know what a lag time is? LAG. So if let's say has anybody ever been on a Zoom video and you see somebody talking, but the sound of their voice comes 3 seconds later? Or if you've ever been on a phone call with someone, like a long distance phone call, and you can clearly tell that they're not hearing what you're saying for 5 seconds after you say it. How difficult does it make a conversation between two people if there's 10 seconds of lag between what you say and then what they hear, and then what they say, and then what you hear? It tends to deteriorate the experience, correct? Well, that's exactly what happens when the myelin sheath is damaged in your body, because your brain requires that instantaneous connection. Oftentimes, if that's impaired even slightly, then your brain gets into this weird kind of a feedback loop, and it can't make the right decisions because it's not getting information back fast. And so myelin sheath disorders can significantly affect your body's ability to function. So yeah, let's go into some of the specific symptoms and diagnoses that happen from that. So 1 second. So some of the specific health problems that will manifest from myelin sheath damage in the vagus nerve are things like gastroparesis. When I was in college, I had a really good friend who had really severe gastroparesis. So I got to see how much suffering was inflicted on this young 20-something college-aged kid at UC Berkeley, because he literally could not eat food and have it digest through his body without sitting there for a week. Danielle, a spleen is on the left side of your body. Your spleen is like your largest lymphatic organ, and the spleen regulates all of your immune function for the most part. So spleen is really important when it comes to the function of your vagus nerve. Definitely, we talk about that a lot. It won't be the last time we talk about that. The spleen is a huge target of interest, especially for vagus nerve stimulation technology. So I'm glad you asked that. That's a great question. Going back to some of the health symptoms that develop from myelin sheath damage, we also see depression, heart disease. Because think about it, your brain regulates your heart rate. And if your myelin sheath isn't sending signals to your heart and it can't time the beats properly, then you can have heart palpitations, you can have elevated heart rate, you can even develop really severe blood pressure issues if your vagus nerve is damaged. So that can also be a really severe consequence of myelin sheath damage. So this kind of stuff is pretty serious. Another really big one is diabetes. So type 2 diabetes occurring in your pancreas can also develop as a consequence of vagus nerve dysfunction because of myelin sheath damage. And we'll go into some of the reasons why that can happen besides inflammation in a moment. But you will notice that these dysfunctions may be seemingly unrelated to each other. Now, if you went to a normal doctor and you said, hey, I'm having heart palpitations, I'm also depressed, and I'm having really bad constipation all at the same time, that doctor might run different tests, but they're almost never going to indicate they're in the current state of medicine as of 2023, as the time of this video. 99.9% of doctors that you're going to see in the Western world are never going to assume a vagus nerve issue to start. They're going to think something's wrong with your heart, or something's wrong with your intestines, or something's wrong with your pancreas. That's where they're going to start investigating first. They don't seem to be trained in looking at what is the top connecting point for how could someone develop depression, gastroparesis, and insulin resistance all at once, all overnight, within the span of a couple months, and it's persistent, and no treatment seemed to fix it, right? Why don't the medications work? Because they might not be even treating the right thing at all. That can be a reason. Everybody knows that if you go to a doctor, they'll order a bunch of tests for you. They're probably not going to find the actual root cause of what's going on. Primarily because there really isn't a good test for looking at the myelin sheath. The myelin sheath are microscopic. They're fractions of a millimeter. They're basically, so think of a hair on your head. One strand of hair, the circumference around that is far bigger than any one single myelin sheath is in your vagus nerve. There's no doctor who's going to put a microscope into your neck and look at this. And also your vagus nerve is multiple feet long. So they'd have to start looking here, 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 and here. Unfortunately, there's just no blood test that can detect if your myelin sheath is damaged. Just not possible. So this is why this kind of thing goes very underreported or even unresolved for years and years and years. So anyway, without going too much more into the detail on testing, the consequences of myelin sheath damage can be very, very severe. So let's talk about the next piece, which I think is probably on your mind. If you can't test for myelin sheath damage, in those situations, my recommendation, generally speaking, is it's oftentimes in health, sometimes appropriate to assume, this may sound weird, but to assume the worst. To just go ahead, let's assume for a moment that, let's say that there is a test and it showed that you do have myelin sheath damage and it is in your vagus nerve and there's something bad happening. If we assume the worst, what then would you do in that situation? And that's part of this process of repair. Main reason why the Facebook group that I'm streaming into is called vagus nerve stimulation and repair, is that's what sets us apart from a lot of these other Facebook groups, because they're going to focus on stimulation, which can artificially boost the vagus nerve, but may do nothing of the sort to repair some of the external scaffolding that supports the function of the vagus nerve. None of these other groups are talking about the myelin sheath or repairing the myelin sheath at all, or how do you restore nerve function when it's damaged. So that's a key thing why I will oftentimes come back to the myelin sheath. It's really, really interesting. So in assuming that the worst is happening, there are multiple approaches that can repair the damaged myelin sheath around the vagus nerve. Some of those fixes may include stimulation of the nerve itself. That's for sure. Danielle, I'll get to your question in a second. So stimulation of the nerve is certainly indicated in myelin damage, for sure. There are certain supplements that can be taken that feed the myelin sheath. I'll talk about what the myelin sheath is, what it's made out of, what are the components, and how can you eat properly in order to feed your body's ability to grow healthier myelin sheath. That's an important thing to get into your diet and to your supplement stack. And so if you combine a couple different things together, then you can certainly start to address myelin health. So let's talk about, like, as far as a generally good approach, if you're going to just kind of do this on your own, here's what I would suggest. Neurons don't typically grow if you don't tell them to grow. So a neuron, everybody, have you guys heard of the term use it or lose it? Right? If you don't use a muscle, it's going to degenerate. Right? If you sit down for a year, your muscles in your legs are going to get pretty atrophied. If you've ever had a broken bone and you've worn a cast on your arm for 6 months, once you take that cast off, those muscles are going to be very, very weak. So you have to start picking things up. You have to start trying to walk to send signals to those nerves to tell your brain and your body, hey, I want these muscles to work. I want you to grow them. I want you to put resources there. So the same is true with the myelin sheath. So part of that can be initially is to stimulate the nerves in the specific region where you suspect there is damage. So if you want to repair a neuron that has impaired function, stimulating it can be a good option. There's a couple ways to stimulate it. I'm going to focus primarily right now, well, I guess briefly, because I don't want to go into it too much. There are natural ways and device ways to stimulate your vagus nerve. Certainly natural ways might be breathing, gargling, drinking a lot of water. Go online and look up natural ways to stimulate the vagus nerve, and you'll find a ton of options. There's like probably 80 different ways to do it, right? Some levels of degeneration of the vagus nerve do require more intensive stimulation of the nerve. That's when you would want to approach it from a device-centric approach, and obviously augment that with more natural things. That's a fine thing to do. So devices that you can do, there are electrical, ultrasound, light-based, vibrational, magnetic, pulsed electromagnetics, these kinds of things. There's a range of options that can stimulate the vagus nerve. I personally love ultrasound, but it's not the only way to do it. So stimulation of the nerve is a good option for getting it to work. From a supplement perspective, some supplements have been shown to support myelin sheath health. Our B12, so B12 supplementation is really important for the health and the regrowth of myelin sheath. So supplementing with that can be good. Now, with any recommendation of a supplement or device, obviously check with your own doctor. normal boring disclaimers. I'm not giving you medical advice here. I'm just telling you this is for informational purposes only, okay? So don't ask me, well, how will I know particularly if I should take B12 or if it's too much? Like, I'm giving you information on the internet. If you want to do a consultation with me, that's fine, but I'm giving you some information. So B12 is really important. Your myelin sheath is also made out of a lot of fat. So supplementing with really good olive oil, extra virgin olive oil that's really clean and healthy is a good idea. Also, fish oil is also a really good idea for getting your vagus nerve myelin sheath to be stronger. Also, one other supplement that we found is really good is lion's mane mushroom. If you can eat lion's mane mushroom as it is grown naturally, you can buy it as the mushroom, or you can buy it in powdered form. There are varying strengths and qualities of lion's mane, so try to source the best quality lion's mane mushroom that you can. That is a proven track record in repairing neurons in the body, so that can be a good idea. Callie, this is really. Oh, so I want to go to the questions before we go to the next thing. Danielle, you asked, what is gastroparesis? Gastroparesis is basically where you eat food and your intestines don't work. So the food sits in your body for like days and days and days, sometimes weeks, and it can be deadly because it can cause megacolon or colon toxicity. Gastroparesis basically means that your vagus nerve cannot tell your intestines to squeeze food through your body. That's what gastroparesis is. Callie wrote, as an iridologist, I look into the client's eye and see myelin sheath issues and recommend an herb and or vitamin to repair. That's actually fantastic. So yeah, that kind of thing is fantastic. You should, I believe actually today, I know that if you go to an eye doctor and get a standard eye check, they do take a picture of the back of your eye. And so, yeah, if you could, I do know that they do that test for looking at diabetes, because oftentimes that can manifest in your eye. So that's an early screening mechanism for people. So certainly not a bad idea. And as well, in assuming the worst, it doesn't hurt to assume there's probably already some degree of degeneration. Given the title of this video is specifically about age-related degeneration of the vagus nerve, these are just things that by almost assumption are going to happen anyway. As we age, the myelin sheath just generally do get less healthy. That's just a thing that happens. So certainly, there are definitely things that you can take to help facilitate myelin health. So good. So let me do the next section here. Just, I like to post the timestamps so people watching the replays kind of know the flow of topics. So here's the key thing. Here is the best approach to not only myelin sheath repair, but also in general, when it comes to your vagus nerve, it's best to combine multiple approaches for optimal results. So individual techniques or individual supplements may provide, they may provide that good window into a solution. However, what I want to remind people of is that you, as a patient or as a client or as a person, you are not running a study. So it's not on you to prove or disprove the effectiveness of one single type of treatment. So let's say you're like, Sterling, I just want to try for the next 6 months, change nothing, but only do lion's mane and see if that makes a difference. I would say, I commend you for trying to kind of like prove or disprove if lion's mane particularly works, but there's a problem with that. Maybe it will work, maybe it won't work, but there's no way that just lion's mane is going to be a comprehensive strategy for anybody. Even if you're at if you're at a really low level of health, if you have a chronic health issue, just supplementing with lion's mane, as good as it is not at all going to touch some of the deeper issues. So I highly recommend that in the assuming that the worst has happened, in assuming that probably you do have some degree of myelin sheath damage, is to just assume that you're going to want to explore multiple approaches at the same time. And some researchers in the field, people especially that I work with privately, will indicate that the things that worked for them was kind of throwing the whole kitchen sink at the problem. So I would recommend by default that you combine as many of the things that you can into your schedule, into your budget, into what you're capable of doing as you possibly can, rather than trying to prove that any one specific thing worked. It's just not a good idea. Leave that to academic clinical research. They're the ones who know how to do, encased studies on specific interventions. Once that study's been done and published, then we know, okay, cool. Yes, lion's mane works together with other things, right? Those studies have already been done. So I always advise a range of techniques. Stimulate, supplement with B12, supplement with lion's mane mushrooms. Get a comprehensive strategy. Also do things like exercise, mindset work, mind reprogramming, getting sunlight, being social as much as you can, learning, reading books, working on hobbies, things that are fulfilling. There's a lot of things that do go into the overall health of your body. It's true. So these all need to be taken into account. Before I go to the conclusion, I want to read Danielle. You wrote, I went to a chiropractor last year. I had a rib out of place. He popped and it helped a lot. Yeah, certainly having things out can be painful. You also wrote, Danielle, does lion's mane mushroom, it won't make me see and hear things? Yes. No, not all mushrooms are psychedelic. Lion's mane mushroom will not cause you to have any hallucinations. It's not that type of a mushroom. It's simply an edible type of mushroom. It's not going to cause you to have any hallucinations or anything like that. So no worries there. Certainly I would, if I wouldn't recommend anything like that. Some people do that, but I'm not making that recommendation. So in conclusion, understanding the effects of aging on the vagus nerve function is crucial for maintaining overall health and well-being as we grow older. Obviously, the myelin sheath is a critical component of that whole picture. So a big thing to focus on, especially here, is really inflammation. Doing as much as you can to reduce stress, to reduce toxicity, reduce exposure to inflammation causing compounds. That means filtering your water, exploring your house for mold, these kinds of things. These are all essential components to reducing inflammation in your body. There are things you can do with VNS that are really amazing. That's why the Facebook group isn't called Lion's Mane Mushrooms, right? I don't believe that I could create an entire Facebook group about lion's mane, but given the wide-ranging function of the vagus nerve and what you can fix if you stimulate it, that certainly justifies having a Facebook group about it. One of the targets of vagus nerve stimulation is the spleen, and when you stimulate the spleen through VNS, through things that stimulate the vagus nerve, you can modulate inflammation drastically and very powerfully in the body. Spleen stimulation specifically is already utilized in treating things like epilepsy, Crohn's disease, depression, rheumatoid arthritis. These are serious complications of inflammation, and they are treated with vagus nerve stimulation. And the target is the spleen. So if you don't know where the spleen is, I certainly encourage you to Google it and read more about that. spleen is an incredible target for reducing inflammation. And as we do these videos on a daily basis, I oftentimes will speak more about specific modalities on what kind of things can you do to stimulate the vagus nerve, where is the spleen, what does it do. We cover a ton of topics all related to this. So if you have an interest in being healthy, aging gracefully, yesterday we talked about reversing your age through VNS. We actually have markers that show that if you successfully stimulate your vagus nerve, that you can reduce cellular age. You can actually age backwards through VNS. So it's not just about getting old, it's about actually not getting old. That's pretty cool. I think that's worth, investment of your time. So I do appreciate you guys coming here and watching this. So anyway, getting back to the conclusion, your myelin sheath is really, really, really important. In the Facebook group, I wrote a little bit more about certainly about the myelin sheath, where it's implicated. If you know about a condition called multiple sclerosis or MS, MS is indicated specifically as the degeneration of myelin sheath throughout the body. Some of the first things that tend to go are lower body function with MS. So that means loss of function in your feet, loss of the ability to walk. You lose control of your legs. Then you lose control of your bladder. Then you lose function in your intestines, and then it moves its way up, and it is a deadly condition. And it's deadly, and it's really just a degeneration of your myelin. So we already have a disorder called MS that is like, this is what full-scale myelin damage looks like. So myelin, pretty important. I would agree. If you guys agree, nod your head, be like, okay, myelin, I should probably take this pretty seriously, okay? Myelin sheath is important. But yeah, so as we learned today, the combination of the right types of stimulation modalities, supplementation, lifestyle modifications can all serve to promote health in your vagus nerve, your body, and in your myelin sheath. So really protecting your vagus nerve and protecting your myelin sheath from damage, from compression, are all really critical. One thing I will add that I didn't get to in the main part of the video is that compression of nerves. So if you squeeze a nerve for long enough, you can also damage myelin. One of the biggest risk factors for myelin damage is in the neck. One of the hardest places to test for too, because you can't really do a biopsy in the neck. You don't want to put a needle in there and take out nerve tissue. One of those areas will be the C1 atlas cervical instability around your vagus nerve. And if you have myelin degeneration right up here, everything from there on down will be affected. So I want to invite you guys again to our Monday, Tuesday, Wednesday, Thursday, Friday videos, where we will be discussing things like exercises and mobility, neck traction, different types of ways that you can actually take pressure off of the neck to give your vagus nerve room to breathe, so that compression of the vagus nerve and of your myelin isn't a factor, so that you can promote growth. So anyway, definitely encourage you to come back for that. But yeah, support optimal function of your vital communication pathway with your vagus nerve and with your myelin sheath. So that'll wrap it up. Thank you guys so much for watching. I want to go to some of the questions here, or some of the comments. Callie wrote, awesome stuff. Thank you for sharing. Didn't know about lion's mane. Yes, I teach herbal nutrition. That's awesome. Yoga, ultrasound, diet, mantras, singing, and I use applied kinesiology to figure out what supplements to find, which supplements to help them heal. That's awesome. I'm so grateful that I have part of your sharings, which I could attend more. Yes, I teach how important the spleen is. Good. Awesome. Yeah, and all the videos are recorded too, so you are able to watch the replay in the Facebook group too. Jada wrote, my nervous system is a mess from Lyme disease. Yes. Anytime you're dealing with an infection, myelin sheath do tend to be a target of the infection. You oftentimes do see, I would call it the pathogenesis of an infection is myelin sheath degeneration. One other really interesting thing that I did see in researching this over the last 6-7 years, is they did a study on patients who had passed away early, they did a test of their vagus nerve, and they actually cut their vagus nerve in half and did a scan. And the biggest indication of decreased health was that the myelin sheath itself had deteriorated like by half. So they saw over a 50% reduction in myelin sheath concentration or volume in the vagus nerve specifically. And guess which two groups they saw the worst degeneration from that they tested? Alcoholics, people who drank alcohol, and diabetics. So alcohol causes a lot of inflammation in your neck, in your esophagus, and that's a big place where your vagus nerve runs, through your stomach. And then diabetes certainly is an inflammatory condition in your pancreas that then spreads to your whole body. It probably does contribute in large part to a ton of damage throughout your body. So yeah, type 2 diabetes and alcoholism are two big risk factors for decreased vagus nerve tone and decreased vagus nerve activity. And also, these people who had passed away weren't 80 or 90. They were 50 years old, just 50. And they tested their vagus nerve. And these are the kinds of tests you can only do once the person is actually dead. It's called a post-mortem analysis. So when I get a lot of questions about like, well, Sterling, certainly my doctor should be able to test my vagus nerve. I'm like, well, once you're dead, yeah, we could look into it, but not while you're alive right now. That would end up killing you if we try to do that test, which is cutting your vagus nerve open and exploring it. So, take those lessons. If you're a drinker, if you're a heavy drinker, you have a very bad path ahead of you. Just saying. Cool. Yeah. So good. Yes. Good that my talks are accessible on replay. TL, you're very welcome. Toonie, great question. What do I think of Ozempic? So Ozempic, for those who don't know, is a weight loss drug. It's in the same class of, you've probably heard of like Wegovy, semaglutide, Mounjaro, and Ozempic. These are like injections that you take once a week, and they help you lose weight. They mimic a hormone, I believe it's called ghrelin, that makes you feel full. This ghrelin is a GLP-1 receptor agonist, and the receptor, guess what nerve this hormone works on? Either when it's produced naturally or artificially from Ozempic. Guess what nerve? If you're thinking vagus nerve, you have it right. So Ozempic, I heard this today. Eli Lilly, Lilly, the company, 5 years ago wasn't even 1/3 of the market share value compared to Pfizer. Pfizer, we all know Pfizer, the big pharmaceutical company, worth billions and billions of dollars, right? Eli Lilly was this tiny little, well, not the tiniest, but not the biggest. They came out with Mounjaro, that got FDA approved for treating diabetes, actually, and then approved later for weight loss. Eli Lilly is now the largest pharmaceutical company in the entire planet right now because of that drug. So it should come as no surprise that drugs that target the vagus nerve are very popular. So Ozempic is a target of the vagus nerve, or that is the target to stimulate specific subunits of the vagus nerve. I'll read Char's thing and then go back to Toonie. Char wrote, "Thank you. Crazy how ultrasound is such a game changer." You're welcome. Awesome. Yes, ultrasound's pretty cool. Been using it all day. Fucking awesome. So Toonie, back to your question in relationship to Ozempic, a lot of reports are now coming out that Ozempic has led to some pretty severe side effects, like gastroparesis. So these are not the miracle drugs that you think they are, truly, right? So there are risks, right? And think about this. They approved Ozempic without doing any long-term studies. And now people are developing gastroparesis and life-altering consequences from it. I mean, I hate to say this because it puts me at risk of being canceled. Because now I'm talking, I'm what am I doing? Casting shade or spilling tea against the biggest pharmaceutical company in the world. That doesn't put me in a very good position, but it's worth it. I think it's worth it. If I could prevent a couple of my audience members from going that route, then that would be good. But, keep that in mind as well when it comes to, again, here's the thing. We're not on the topic. When it comes to stimulation of the vagus nerve, electrically stimulating the vagus nerve has not been studied for that long. And we do not know what the long-term effects are of electrical stimulation of the vagus nerve. So there are, I don't know, just figured I'd mention that. Some of these things that act on the vagus nerve may seem like, wow, that's really cool. I can electrically stimulate my vagus nerve, but we just don't know. And it may work while you're stimulating it, but what happens when you stop? What's the refractory effect of stopping it? Oftentimes it's stopping the Ozempic that then makes your vagus nerve malfunction. So be very careful with these things, you guys. Like, this stuff is not a game. Vagus nerve will make or break your life. This is important. So anyway, thank you for bringing that up. Sandra, Eli Lilly now studies on Alzheimer's. It's a potentially good target, maybe. I mean, it makes sense. I mean, certainly Alzheimer's is as of yet an uncured condition. There aren't very good options for it. And I do believe that vagus nerve interventions will be the solution to Alzheimer's. But if we found that solution yet, I don't believe we have. My suspicion is that the treatment for Alzheimer's is going to be ultrasound vagus nerve stimulation to increase acetylcholine in the brain as a treatment for mild to moderate Alzheimer's, at least to start. That's what I'm actually doing a research project on that right now. So I can't say more, but TL, you have a question. My vagus nerve is overactive. It pulses a lot. Well, your vagus nerve probably isn't pulsing. Maybe it's your blood pulsing because you can't feel your vagus nerve pulsing so much. Just want to clarify there. But you also wrote, and I have had past issues with a hoarse voice, and sometimes my vagus nerve hurts. So how do I get it to calm down? I noticed one thing that helps is a good night's sleep. Okay, so let's do a little bit of disambiguation. When you say my vagus nerve hurts, your vagus nerve itself doesn't have receptors inside of it. The organs that it connects to can feel pain. So you do have to be a little bit more specific with that, but I'm so glad you asked, because certainly, thinking that your vagus nerve is pulsing when it doesn't pulse, and indicating that as like you have blood vessels that run right next to the vagus nerve that can pulse, and that can give you an indication of, the vagus nerve pulsing, but it's not pulsing. So getting these functions really clear are going to help, because if you get those things mixed up, the kind of conclusions and the meaning that you derive from that can be drastically incorrect. So how do I get it to calm down? Well, so TL, could you clarify? So a hoarse voice doesn't indicate an overactive vagus nerve. And also your vagus nerve doesn't pulse, and you don't feel pain in the vagus nerve. You feel pain in other things. So nothing you said there indicates an overactive vagus nerve at all. The hoarse voice would more indicate that your vagus nerve is having maybe difficulty, unless you have a vagus nerve implant. But yeah, a good night's rest is good for anybody. That doesn't say, I would recommend that. But yeah, if I were just going to answer the question of how do I get the vagus nerve to calm down, you have to tone the vagus nerve. So if you have a muscle that's twitching, sometimes trying to repeatedly, so for instance, I had a car accident. I was rear-ended. It wasn't my fault. The other driver was 100% responsible for rear-ending me on the freeway on February 14th on Valentine's Day on my way to see my girlfriend in 2016 in California in Sacramento. Okay, so I didn't do it. All right, I was driving very safely in my brand new Toyota Prius, listening to NPR, and we came to a stop. I was rear-ended. I developed a neck issue from whiplash. I developed twitching down my arm. So twitching, when your hand is twitching like this, can happen because of irritation of the nerve. Now, would you call that, would we consider that to be that the nerve is overstimulated chronically? Because the nerve isn't twitching all the time. It occasionally twitches. And the muscles are twitching. The nerve is just irritated and errant signals are being sent down it. So, but that happens occasionally if I don't sleep correctly, right? If I compress my nerves in my neck, my radial nerves that go to my hand and my arm, then I irritate it and it's overstimulated from irritation. But the way that I would go about fixing it would actually be to lift weights to try and actually kind of normalize the signals going down to it. So that would be considered muscle toning. So it's counterintuitive, right? You'd think, well, because the thing you'll quickly realize is if you have twitching in your arm, just sitting down and doing nothing doesn't do anything. It continues to twitch, right? So you have to do something. And oftentimes working that specific muscle group that is having the issue is oftentimes more in line with the solution that helps regulate. Toning simply means normalizing function of the vagus nerve. So that's what toning is. But yeah, anyway, TL, I hope you don't take this personally. I'm not trying to narrow you out or anything like that in the crowd. But I would love it if you could clarify that a little bit. Because generally speaking, your vagus nerve isn't known to pulse. And your vagus nerve doesn't have pain receptors in it. So it would be more helpful to understand where you feel the pain. Is it in your neck? Is it in your heart? Is it in your side? Is it in your gut? That's way more valuable information. Kind of like this, like the way I kind of think about this is, let's say that you're involved in let's say you have some reason to go see an attorney. You go see a lawyer. You don't go to the attorney and say, I think I'm guilty of, this infraction with with a tenant in my property. The attorney is immediately going to, blah, 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 blah. You don't determine guilt or non-guilt. All I need to know are the specifics. What was in the contract? What did it say? What happened? What was said? Right? So you're assuming way too many things in that comment. So go, again, hopefully this is helpful for others too. If you are trying to formulate a better question of how do I understand what's going on with the vagus nerve? And just so you guys know, I've probably had 4,000 phone calls with people from the Facebook group. I do free consultations with people all the time. I get on the phone and I talk to people specifically. I consult with $1 million companies. We do research with stimulating the vagus nerve. I've spoken professionally at public and private corporations. So I definitely tend to know what to ask here, for sure. I do work with doctors. I do work with neuroscientists. So I'm not just coming on here as some mommy blogger influencer or anything like that. I come from a place of experience. So, but yeah, anyway, TL, what I would encourage you to do, let's schedule a call. I'm just going to send you a quick message, TL, if you don't mind. I'm just going to say, hey, I can do that here on my end. Hey, let's continue the conversation further if that's cool with you. All right, cool. So I'm just gonna send you that message and reply if you're interested. If not, no pressure. Totally not a big deal. Okay, cool. Love the question. Jada wrote, I dropped pharma and I'm doing great. There are too many side effects. I prefer to stick with natural solutions. Definitely, again, I want to be fair, right? Because one thing I've noticed is that there are people here in the Facebook group who are currently on pharmaceutical medications. What we want to be mindful of, and I've been on both sides of this, because like after my car accident, I did have to take like gabapentin because it was one of the only things that helped with the twitching. But then I had to find more natural solutions because I was getting side effects from it. But I've been on both sides of natural and pharmaceutical solutions. Honestly, at the end of the day, I'm just like, whatever can help is what I'll try. And now I'm way more mindful and careful to really read what are the potential side effects from doing this before I start it. So with pharmaceutical drugs, you're almost guaranteed to have a laundry list of potentially bad side effects. So I'm with you there, but still there are many who are on pharmaceuticals and you're not any worse for doing it. Okay. But yeah, definitely natural solutions. While they may not fix you as fast, they don't come with the side effects and they can actually work too. So thank you. Sarah Keller, excellent program tonight. Awesome. Thank you. We got 3 likes on that. Thank you guys so much. I'm glad you guys like that. Sandra, you wrote, looking forward to vagus nerve and Alzheimer's discussion. Absolutely. And like I said, we are currently starting up a research study on the usage of ultrasound to stimulate the vagus nerve with specific testing frequencies to test enzyme dynamics in the production of acetylcholine in the brain. So I'm working with some big people on this, you guys. I'm working with I don't want to name drop. I'm not trying to humble brag here, but I am working with some of the people who are the largest, most well-known names in Alzheimer's treatments and ultrasound. They're absolutely gung-ho about collaborating on research, since I have a lot of experience with ultrasound stimulation of the vagus nerve. This is like, I think at this point in time, I am the number one proponent and most knowledgeable human being on the planet in ultrasound stimulation of the vagus nerve. Most likely, just by sheer nature of time and number of clients that I've worked with. So I definitely do know what I'm talking about. Cool. Awesome info. Thank you, TL. Toonie Harris, great info. Thank you. You're welcome. Audra Burton, can I schedule a call? Totally. 5 herniated discs, C4, 5, 6, T12, 5, and S1. Definitely some problem areas. Definitely. Yeah. Here, Audra, I'll send you a quick message here. Hey, Audra, let's chat more after the live. Cool. So yeah, I just sent you a message. I see we communicated a little bit in the past. Great. So cool. Well, I don't want to keep you guys too much longer. I got some errands I got to run with the old partner, like groceries and stuff. So I'm going to run. Thank you guys so much for watching. I look forward to continuing the conversation tomorrow. Same time, same place, Monday. I believe I'm going to try to touch on some neck related strategies for releasing compression on the vagus nerve. Most likely that's something that I'll talk about. So if that's of interest to you, if you have any neck pain and you have some symptoms and even if you don't have neck pain, you could still have compression and you just might not feel it. So that could be a problem too. But if you have anything that you suspect is a vagus nerve issue, then absolutely knowing about how to fix your neck is going to be helpful. We have some great resources for that too. All right, cool. Got to run. Thank you guys so much for watching. We'll wrap it up here on the YouTubes.